So in forensic anthropology and bioarchaeology as well, we're interested in identifying evidence of trauma, trauma that occurred before the time of death, around the time of death, or after death. So this will help law enforcement officials gain a better appreciation for what led to the manner of death. In addition to that, with respect to bioarchaeology, for example, understanding trauma can give us some insight into, say, violence in the past. If we were looking at hunting and gathering tribes, the question would be, if we look at those remains, do we see evidence of a lot of intra-group trauma, in contrast to, for example, when agriculture begins to emerge? What types of trauma did we see evolve over time with respect to the way that people behaved to each other? Do we see a different distribution in trauma, for example? Do we see more evidence of trauma among individuals that would define themselves with a female gender? Or do we see it with respect to males? So a number of things that we're going to be interested in. We're going to be able to recall a few basics about cells and the process involved in bone remodeling, so we can check that off. We're going to be interested in understanding the impact of cell imbalance, and we're going to be able to define osteolytic and osteoblastic disease. And that will give us insight, for example, into, give you a quick example here with osteolytic lesions. That tends to happen with tuberculosis, syphilis. So it does give us insight into the disease that the individual suffered. And that can be used for forensic purposes to help achieve positive identity or provide us with an understanding of the diseases that affected the civilization that we might be examining archaeologically or bioarchaeologically. We're going to need to define some of the terms associated with the timing of trauma, before, around, after. So ante-mortem, we have peri-mortem, and we have post-mortem. We want to be able to define some of the types of bone trauma that we see. So the characteristics of blunt force trauma versus projectile trauma or sharp force trauma. And we're going to be able to recognize some of the examples of trauma types. And for example, specifically with respect to projectile, we want to be able to identify the point of entry of a projectile and how it exited, for example, a bullet. And that could help us define, again, the manner of death. So here I have a warning. There are images of injured bone. So we're not going to see any blood or anything to that effect. But again, we do see bone here with different types of trauma on it. So I'll give you that warning as we move ahead. Okay, so bone, it's a type of tissue, brief points here. It's a type of tissue. It's in fact referred to as a hard tissue. And one of the basics of any ecosystem, whether or not we're talking about the environment or we're talking about our own bodies, our body is an ecosystem. One of the principles that it operates on is the idea of homeostasis. Homeostasis, fancy word for balance. And we know that in any ecosystem, we need to have balance. So we're constantly losing skin cells, for example, and we're replacing skin cells. The same happens with our hard tissue. We lose bone, we regain bone. And when that process of balance breaks down, this is when we start to see osteoarthritis, for example. We don't have the same type of bone replacement over time, so we get a lot of bone loss. That begins to impact individuals, and this is an indication of various types of disease. If I can go back to the skin for a second, after we have a laceration, a cut, it eventually heals, and it quite often leaves a scar behind depending upon the severity of that particular trauma. The same thing can be said of bone. So when we look at bone, we can see evidence of scarring, and this allows individuals to comment on the timing, for example, of that particular trauma in question. So we're looking at bone remodeling, a little bit about growth and maintenance and healing. And as I've pointed out, bones are a type of living tissue. We've said that it's a hard tissue. There's three types of cells involved in remodeling, in bone remodeling, and we see them diagrams 1, 2, 3 here. I'm going to label these as we go along. So we have our osteoclasts, They're removing bone. We move to our osteoblasts. They're preparing the surface for the development of bone, and our osteocytes, really responsible for the formation of bone proper, reconstructing that bone matrix. And as I've pointed out, typically there's a normal balance between the osteoclastic activity and the osteoblastic activity, such that we lose bone, but we're also replacing it at the same time. When we don't have the same type of osteoblastic activity, we tend to see bone loss, and that can be a result of aging, for example, metabolic disease, hereditary disorders, or even acquired disease, for example, with respect to syphilis. Syphilis, there's a lot of osteoclastic activity, and it creates what we refer to as osteolytic lesions. Holes in the bone. In contrast, some types of cancer, they do this. Other types of cancer, they leave osteoblastic lesions, which are bumps. Okay, so we have three terms we're interested in here, and I've referred to them with respect to the timing of bone injury, and on the individual to our right, your right and my right, we see a number of areas that show us clear trauma. I'll go ahead and label the obvious ones. So take a look at them, and I'll let you get a head start here. How many areas do you see with evidence of bone trauma? Okay, so you've probably come up with the most obvious one right here, number 1. And then moving dorsally or posterior to that injury that we see on the frontal bone, we see another hole. And then moving a little more medial, we see another hole. If this is where you stopped, well, you've got the obvious ones that show us very clear indication of bone injury with no healing. Right? So we see absolutely no healing in those areas. And that would allow us to suggest that the individual died as a result of these particular injuries. If you said that there's 4 and you pointed out this kind of divot here, you're absolutely correct. And what we're seeing here is evidence of healing. So at one point of time, there was a hole there. The process we call is, go down here, trephination. It's to drill holes in individuals' heads. A lot of people believe it was to release evil spirits. It's a valid explanation. I'll tell you why in a second. Other explanations would include, I'll put a colon here, release evil spirits, or address intracranial pressure. So in the case of intracranial pressure, and we know when individuals bump their heads, our brains can swell. This is a procedure that is documented, and if we look at this individual, we say, okay, maybe we're seeing some further trauma here, a fracture, and they were trying to release pressure. That would make sense, but I'm seeing a few areas that have been trephined. And my conclusion would be here, I'm not going to go with the idea that this individual fell down a lot and bumped their head a lot and there was a lot of intracranial pressure that needed to be released. I'm not going to buy that. I'm going to go with releasing evil spirits or demons. And now we need to add a little bit of a caveat here. Historically, people understood behavioral differences in individuals, for example, schizophrenia, hearing voices in your head, perhaps multiple personality disorder or some other psychosis, as an individual being possessed. and they would try to release those spirits. For example, if somebody was hearing voices. So this really, it's a testament to very early neurosurgery for different reasons than we might do today, and the ways that we might go about treating this. But either way, that I'm seeing, for example, 4 trephined areas, that would suggest that this is an ongoing. There's an ongoing issue here. So I would probably say that this individual, in all likelihood, suffered from mental illness, and individuals in the community, the healers that did trephination, they were trying to heal the individual, and unfortunately, these procedures led to their demise. Now, you're probably thinking, okay, so how can you say that these 3 are responsible for the individual's death? I've said no healing. What I'm seeing here on the edges are very clean, sharp edges that would be consistent with using a tool. And at various points of time, in more modern times, people use drills and drill bits, a type of auger. In prehistoric times, people used rock tools to do this. So it is going to leave a very characteristic feature on their very rough edges. And when we don't see any remodeling, and if I go to number 2, and I know it's not the greatest image here, I do see, I'm just very carefully in here, this region, I do see a little bit of healing, I think. I'm not going to zoom in, but for argument's sake, I'm going to say that I do see some healing. So it allows us to identify the placement. If I'm seeing some healing here on hole number 2, well, this was probably a hole that was done at an earlier time, and then they attempted to do it again, and maybe 3, we're seeing some healing right in this area as well. So I'd say maybe the order, correctly if I was to label it, A, this is the first one, B, the second one, and the individual died from C. In more recent times, and obviously we have number 4 over here, which was at a much earlier stage where we see full bone remodeling there. So that allows us to talk about, again, the timing of these injuries, and the specific terms that are used would be antemortem, which means, I'm going to switch over to white here. This is before death. Perimortem means around time of death. And postmortem means after time of death. So before death, we're seeing evidence of healing. Clearly, we do see that in the bone. Around the time of death, we see no healing or limited healing. After the time of death, we generally see a different type of breakage pattern. What I want you to think about, the best example I can give you at this time would be a stick. If you went into the forest and there was a tree, and you took a branch off of that tree and you tried to snap it, it would bend. Before it finally, eventually, if you're bending that branch enough, it's a green branch, it will eventually snap and it won't have a clean break. In contrast, if you were in the forest and you picked up a branch that was laying on the ground that was dry, I don't have brown here, so I'm going to, I don't know, I'll use blue for a dry bone, and you bent it, you're going to have an immediate break in the center. And that's going to be very clear. The same thing can be said of bone. So around the time of death, bone is going to be much more similar to a green branch. We can even use that term. It's green, so we get a type of fraying of bone, or comminuted fractures where it's all smashed up. In contrast, after death, we're going to see very clean breakages of that bone with very clear edges that have been snapped with no fraying. So how does one distinguish between, I'll erase that for you, between the time of injury? As I've pointed out, ante-mortem, we're looking at healing. Around the time of death, we're seeing no healing or limited amounts of healing. And after the time of death, we're seeing a very different type of breakage. Rewrite that there with an R. We're seeing a different type of breakage pattern associated with that bone. Okay, so there's a number of types of trauma here. We're going to be mostly interested in blunt force, sharp force, and projectile. Okay, so blunt force, it's a type of crushing force that impacts bone. So if we look at our cranium, and remember I'm calling it a cranium because there isn't a mandible associated with it, so it's not a skull. This is a cranium. We see blunt force trauma on the temporal bone. As for a definition, we can say blunt force trauma, it's a type of crushing force that's a result of a wide object that causes compression. It causes that bone to bend and eventually shear and break, depending upon the amount of pressure there. So what we're seeing here, this is a significant amount of force. It also allows us to identify, let me erase this here, the way within which the trauma occurred. So we have an object that would have moved, and I try to draw this in as such, this way. So there was more force at the end. Say this looks like some sort of a club, for example. We have more force at the end of that club, which causes shearing and fractures to radiate through, and we don't see as much moving towards the handle end of the club, for example. Characteristics of this, blunt force trauma, it's a result of a slow load of pressure that's being applied to bone. It causes a depression, and we see fracturing and discontinuities. So what we're referring to is the fracture lines that radiate out from the injury. So here we see a, pardon me, a diagram of some discontinuities, fracture lines. So there's a type of injury that's occurring on the frontal bone. Pressure is being distributed in a wide area. It's radiating out that pressure, and it causes fracture lines, and there was enough pressure here that it actually causes discontinuity, fracture radiating out. And there's another one on the kind of parietal, occipital area on that lamboidal suture. And because of the shape of the object, and Bass talks about this in some of our videos, it tends to leave a signature fracture about the same size as the implement that was used on the individual, and quite often an object will fit into there with a good degree of reliability. And because of the pressure, again, it begins to radiate out that pressure and causes fracture lines. And here we don't actually see any shearing force because of the pressure was so localized in one area. So it did radiate out, but it didn't cause any further breakage, for example, in these regions, to shear inwards. That would require more force. Okay, so sharp force trauma. one of the characteristics is going to be, depending upon the object that's used, the absence of bone. So it does create a laceration in bone. For example, if we look at the frontal bone on this individual, in this region, I'm seeing blunt force trauma. And characteristic of what we've seen on the previous slide. In contrast, if we move to the parietal area, we're seeing sharp. So we have the difference in appearance, and actually this helps us understand perhaps what's happened here. We have sharp force trauma, significant trauma, and this probably caused the individual to fall forward, I would imagine, in the situation, and they struck their head on a hard object, causing the blunt force trauma that we see on the front of the individual. There could be a variety of different scenarios, but that's one possible scenario here that an individual might want to examine further. So as for a definition of sharp force trauma, we're talking about a lot of compression that's taking place. So we can say dramatic compression. There's a shearing force over a very narrow area. And some of the common implements that would be used that would produce sharp force trauma would include knives, axes, sharp-edged implements, some sort of object with a very sharp, narrow edge, and it's going to produce this type of laceration. So the characteristics, we have a rapid load of stress that just causes that bone to fragment and break away entirely. Whereas blunt force trauma, there isn't quite enough pressure there to cause that type of shearing force. So we do see a clear puncture here associated with sharp force trauma. And, you know, if we're looking at some sort of a projectile, it would cause the same thing. An arrow, it wouldn't be as large as this, but an arrowhead on the side, it would see clearly a hole, and it might have some discontinuities associated with it, depending upon the force of the arrow. So there's some physics involved here. We're not doing any physics. Another characteristic is we tend to see fractures. The discontinuities, they really depend upon the object that has been used. So we are seeing some discontinuity here with respect to the particular type of injuries. And because they're connected, they really occurred pretty much at the same point of time here. And we're not seeing any evidence of healing. Projectile trauma. And we see a good example of projectile trauma here. This would be caused by a bullet, and we see very clear discontinuities associated with that particular injury. A definition, we see discontinuities as a result of dynamic speed. Okay, so we have a puncture. And we have discontinuities as a result of dynamic speed. So those fracture lines. Characteristics associated with projectile trauma. Obviously, as I pointed out, we see discontinuities, clear fractures, and often we have a small entry and a larger exit. So let's take a look at exit versus entry wounds. And here again, we can refer back to Dr. Bass, and we do have signatures for really any object that's used, as he's discussed, for example, from a club to a hammer to a golf club. They will all leave very different signatures on bone. Looking at, for example, a projectile, the entry signature really tells us about the trajectory of the object. Okay, so we can say the trajectory of the projectile in question. So we see three images here, one that's round up at the top. And we're seeing fractures, discontinuities there. We have oval, and we have what's referred to as a keyhole, because it looks like an old-fashioned keyhole. Around entry, as pointed out, the trajectory tells us that the projectile was perpendicular to the bone's surface. In other words, the projectile entered at roughly a 90-degree angle to that bone. And there's a fairly clean, round entry, and depending upon the amount of force there, we will see fractures. Oval entry, this refers to a projectile not entering entirely perpendicular. So one of the classic examples here is a tumbling bullet. So the bullet enters as such instead of, go up to the top one, enters vertically rather than in its normal trajectory, and it creates an oval entry. The keyhole entry, this tells us that the entry of that bullet, it was not at all perpendicular, and it causes a type of grazing. So you have the entry, and at the top where it's grazed, you have bone breakage. So looking at the keyhole here, I'll switch over to white. The entry was as such. It was not perpendicular, and it caused the bone, I'll go to red, caused the bone in this area to fracture off as a result of being grazed in that area, not struck entirely at a 90. So the trajectory, not perpendicular, can be defined as a type of grazing feature. Let's take a look at a couple of images here. Okay, so here we have an example of projectile, and we can discuss a little bit about the amount of force that was there, because we continue to see bone in this area. So it has not broken away. So we're looking at something that didn't have a lot of force behind it. For example, a slingshot could do this, and we see that fracture line as such. Looking at this, I'm not seeing really anything that would be round. It's going to be a round slingshot, but anything that would indicate that it was spinning in a different direction. It certainly doesn't have the shape of a bullet, and we're not really seeing a keyhole, so this is pretty much straight on. I would suggest it probably, looking at it, I am seeing a little bit in this area of kind of breakage. So I would say it probably came in as such from a higher location and caused some breakage, which resulted in the fracture. Here's a good example of a tumbling bullet, as I pointed out. So again, we have an entry that has the general shape of that bullet because it didn't enter in a manner that it wasn't spinning. So, over space, as velocity is lost, this can begin to start going through that tumbling motion, and it produces a particular type of injury, which helps individuals identify perhaps the distance with which this took place. So here we see our keyhole defect, sometimes referred to as a tangential strike, and the bullet where it had its greatest amount of force, so underneath or inferior to that bullet, we have a very clean entry. If we go over to the keyhole defect, we can see that in this area here. Okay, and again the sides. However, where the bullet has this type of sloped surface and kind of pries up, right? And that's really what it's doing. It's prying up at that bone as it's entering. It causes breakage, leaving the feature that we see on the right, that keyhole defect. So if I label this A, the production over there, and B up here it's producing this type of feature. So it tells us the direction. So when we see this, we know that this is the entry. The other thing is the entry is, generally speaking, going to be smaller than the exit. Okay, so three images here. The two smaller ones that we see on the left-hand side, they correspond to each other. So we are seeing, and if again I drew this, a type of a keyhole fracture. So telling us that this was not direct. The bullet was moving as such. And the exit here is much larger, and it almost has a crater-like feature where bone has blown out of these areas. Moving to the image on the right, the entry, and it's hard to see, but here it is on the back. It's fairly round, I'd say. We're not seeing a whole lot of fracturing in there, so range would be fairly close. And again, because the amount of pressure associated with this particular weapon, the exit is quite large. So trauma assessment, a few things we can go through that you should be focusing on. The assessment would include a description of that wound, where it's located, what you're seeing. So you want to be able to list the bones affected. So if you see something that's present on the, say, frontal, right, and we'll say left side, you want to say that. So list the bones and the areas that are affected. You want to be able to note the type. Are you seeing blunt force? Are you seeing sharp force? Are you seeing evidence of projectile trauma? It's also important to count the events, see how many events are actually involved with this particular individual, and you're going to want to note whether or not you're seeing something that has evidence of healing or the lack thereof. And that will allow you to say something about whether or not the injury is antemortem, perimortem, postmortem. So in your assessment, really, what I'm looking for is an explanation. Okay, so obviously there's right and wrong answers, but you know we're working from pictures in this particular example, so you don't have that opportunity to really look at it in a whole lot of depth. You can zoom in on it, but really what I want to see is if you think it's, for example, you're seeing some type of healing, you might not be. But the examples that I've used, it's going to be fairly clear. I want you to talk about antemortem and explain why you would reach that type of conclusion. The other thing is we're looking for any particular types of signatures here as well. You know, what you're seeing, is it indicative or does it represent a smaller object that would be more consistent? For example, if you were looking at blunt force trauma with a baseball bat, you know, and the thing about a baseball bat, if we consider this, if this is used, or some sort of a club, if this is used to injure an individual, and we say here's the area that's impacted, right? So we're going to have the greatest amount of force is concentrated here on the area that's closest to the cranium as this engages in that traumatic event. So we're going to see a lot of pressure distributed here, but we're also going to see that injury extend out further to that region. This is going to be very different than if somebody had was injured, for example, with a. See if we can draw it in quickly here. You know, with a hammer. You're going to have a very different type of appearance, and especially with the amount of force that an individual is using to wield such objects. So our force, it's going to be much more concentrated. We're probably going to see radiating fractures as well. We'll probably see some radiating, again, depending upon the force. We're going to see those fractures radiate. Okay, so I think that's where we're going to leave it with respect to trauma. Um, things that you are interested in identifying, obviously, is the type. Okay, so the type of trauma, want to see some sort of assessment if anything is there. Are you looking at blunt, sharp, projectile, and obviously why? What are those characteristics? In addition to type of trauma, timing. So the timing of that, make that into a U. Timing of the trauma, is it ante-mortem? Is it peri-mortem? Is it post? And again, why? How are you reaching those conclusions? The other thing that we're interested in that you should always be assessing, aside of trauma here in the sense of somebody being purposefully injured with an object, with some sort of projectile, is also disease. Okay, and as I pointed out, many diseases cause Okay, so some diseases cause osteolytic lesions in the same way, for example, that smallpox affected individual skin. Tuberculosis will also affect particularly bone. So osteolytic lesions we tend to see associated with syphilis, tuberculosis. And I've assigned you readings on this, so I expect that you'll look over that material. But just a couple of examples here. Also, leprosy. It tends to cause that. Sometimes we see osteoblastic lesions. And depending upon the area, we can see that associated with leprosy, for example. It can also produce some osteoblastic lesions, excess bone growth. The other things that we should be familiar with, and again, as I've assigned, is being aware of some of those bone features associated with disease. For example, parodic hyperostosis, cribroorbitillia, and another one I wanted to include was enamel. Linear enamel. I think I've spelled that wrong. Doesn't look right. Yeah, there we go. Enamel hypoplasia. That happens. I'll just strike that out. That's always good to show that we edit. Either way, make sure that you take a look at some of these in your textbook, and this gives you a few keywords for stuff that you should be focusing on with respect to bone features and disease. Okay, I'm going to leave it there. Take care.